All right. So in as much as giving birth is actually a very vital stuff, there are also the dark sides of giving birth, right? So some women after giving birth they could actually become traumatized, all right? It could be due to several things, all right? One of the reasons could be the type of treatment they receive from the healthcare professionals, from their husbands and all of that. Do you understand? As during the birth process. So birth-related PTSD, all right? PTSD, as we all know, is post-traumatic stress disorder. So different things could cause the post-traumatic stress disorder. Do you understand? So this one we're saying is following childbirth. You understand? So it's just a psychological development disorder. Okay, it developed after like somebody had like a birth experience and the experience was not nice. Do you understand? So what could be the possible reasons why the person's birth experience would not be nice? Maybe the person was expecting a vaginal delivery but it didn't come through, all right? So they had to now go for all those cesarean section. Maybe the bleeding was too much. Maybe there was loss of control, or the person was feeling helpless during labor. Probably the care that they rendered to the person during the labor was not really nice, Maybe lack of support from medical staffs and your loved ones. They kind of felt like they stabbed you when you were pregnant, Unexpected complications. Maybe everything was going on as planned, and during the time of childbirth, some complications are set in, So even a medically normal birth can be traumatic, right? Depending on how the person's lifestyle, his training, you understand, and all of that. Some women, maybe they never felt that a pain close to the pain of childbirth before. Do you understand? So all these things could actually traumatize someone, So common symptoms is the woman is not happy, all right, because they're having flashbacks or nightmares about the birth because it wasn't nice, all right. Hypervigilance, all right. Avoidance of reminders. Some people, they don't even want to go to the same hospital again, all right, simply because the experience they had in the hospital wasn't a nice one, all right. Emotional numbness, guilt, shame. This could be maybe the baby died, you understand. Difficulties bonding with the baby or your partner. All right, probably your partner didn't actually give you the right support you needed for that time, so you're beefing them up. So who can be affected? Mothers who experience trauma during childbirth, all right. Partners who witness the distressing event. Sometimes it's not even you, it's your partner. Maybe they watch you give birth and they were like, guy, this is so crazy. People with a history of trauma, people that can easily get traumatized, people that can easily get anxious, people that can easily get depressed, So treatment is what you just link up with your peers again, try to reconnect with people, feel happy again. There are medications for depression, medications to make you sleep, Then education and validation. All right, this thing should always be, the right knowledge about all of this should be always be given to women, all right, not until they are about giving birth, all right, but before then, all right, they should know what's up with everything that has to do with childbirth. Okay, so that's just what is known as a birth-related PTSD.